Healthcare is making headlines all across the nation, and the news can be frightening. But what exactly is changing, and what exactly has stayed the same? A lot of Summit County locals aren't sure, but they know one thing: premiums will go up. In 2018, the increase for Summit County is 36% if you're buying insurance on the Obamacare marketplace. But there are ways to save money, and there is hope no matter what your income. We sat down to talk healthcare with local experts who have helped people save money, sometimes in excess of $600 to $700 per month for a family of four. Welcome to Krystal Q&A as we talk about healthcare. Phil Lindeman with Krystal 93 News, and I am here in the studio with folks from FIRC. We have Danielle McQueen and Tamara Drangstveit, and we are talking healthcare. Healthcare, the big bad gorilla in the room right now. So confusing and so up in the air for a lot of people, especially because a lot of people have been seeing headlines all over the place about changes that could be coming, or maybe they've happened already, but it just makes for a lot of noise. So we'll start right at the top. What can Summit County locals expect when it comes to changes to healthcare? What are the big things right now?
Well, thanks for having us, Phil. Yes, you're right. There is certainly nothing like health insurance to make somebody want to throw a temper tantrum. I really think that to sum it all up, right now for Summit County residents, what we can expect is really more of the same. A lot of the changes that you're hearing about on the federal level just don't apply locally. Sadly, the other thing that we know we can count on is that all of us are going to experience an increase in our premiums, whether we're business owners or individuals who might just be above the tax credit limit. Sadly, we'll see more of the same in terms of premium increases. And premium increases, remind me, what is it going to be for most of Summit County this year or next year? On average, for folks that are shopping on the marketplace, if they don't qualify for tax credits, they can expect about a 36% increase. Wow, so a pretty hefty increase. How about people who are getting insurance through employers? Are those also going to rise just because of the state of insurance right now? Likely they'll see some increases as well. It depends on a lot of different factors like the size of the business and the utilization. But unfortunately, I think for our small business community, and I certainly can say this on behalf of FIRC, we have seen some double-digit increases in our premiums as well. Okay, so lots of changes happening, and the big one, of course, the dollar sign. People will be paying more. And up here in Summit County, that's kind of a tricky thing because people are working sometimes 2-3 jobs simply to pay rent and simply to live up here. What can Summit County locals be doing right now as changes are in the works and on the way to be, making sure that they are getting the care that they need for a price that they can afford? So I would really say the fundamental thing everybody has to remember is it's important not to make assumptions. There actually are things in place that can help a lot of our residents, certainly not everyone, but if you're a family of four and your income is about $98,000 or less, you do qualify for tax credits on the marketplace. And if your income is significantly lower than that, you might qualify for Medicaid or your kids might qualify for CHP+. So I think the most important thing for everybody to remember is question assumptions and make sure that you're doing your homework and you're at least taking the time to see whether or not you do qualify for some kind of support. Yeah, so just don't assume because you think, wow, I make more than the limit, or wow, because I'm relatively healthy, or maybe even I have a pre-existing condition. That's not true. Talk a little bit about that, some of the changes. So pre-existing conditions, that's a recent change that insurance companies can no longer say, we will not work with you because of that.
Yeah, that is a change that was brought about by the Affordable Care Act. The Affordable Care Act made sure that health insurance companies could no longer charge you more for premiums or not cover you due to pre-existing conditions. A lot of people still believe that is true, but it is not.
And along with Obamacare, that's another thing, is that it is still in place. The marketplace is still here. The penalties also still exist if you don't sign up. And that's, again, one of the things that gets confusing with a lot of coverage and talk about things that could change. As of right now, Obamacare is still in place. How about some subsidies? Some of the ways that people can afford, maybe to cut the cost of insurance.
Sure. So If you are a single individual making around $48,000, you are likely going to be eligible for subsidies. A couple making around $64,000 or under, a family of 3 making around $81,000 or under, and a family of 4 making around $98,000. And there are, just to explain the subsidy a little bit, you apply right now for that tax subsidy, and you're deemed eligible by your annual income projected for 2018. And if you're eligible, that tax credit goes to your health insurance company to lower the cost for you monthly.
Okay, so it's not exactly cash that's sent to you. It is then applied towards the cost.
Yeah, the only time it would be cash sent to you is if you enrolled in the marketplace all year and you didn't take that tax credit up front, and at the end of the year you were eligible, the federal government will send you that tax credit in the mail.
Okay, so there are ways to save some money, even if it's not exactly what you think it might be.
And there's also a few ways that a lot of folks out there who are just employed individuals can lower their taxable income, like by enrolling in an HSA plan. HSA eligible plans typically have a higher deductible, but they allow you to open a health savings account, and whatever you contribute to that account lowers your taxable income. As well as folks opening up a traditional individual retirement account or an IRA, whatever you contribute to that will also lower your taxable income.
Okay, great. Some ways to get a little tricky with it, or at least to make sure that you are taking advantage of everything, even if it's deep, deep, deep down on the lines of a bill somewhere. How can FIRC help folks, especially locals, no matter the size, individual or a family, find some of these credits and find what they're eligible for?
So I think for a lot of folks in Summit County, because they have seasonal income or they work multiple jobs, or their income, changes from month to month, and maybe they own a small business, it can be a little bit tricky to navigate this process and really have a sense of what your income is going to be. And so at the FIRC, we have a whole team of health insurance enrollment guides who are experts in all of this and certainly can help you figure all of this stuff out. You are also welcome to go on the Connect for Health Colorado website, and there are some calculators on that website, and you can get started. And then if you get stuck in the process, you're of course welcome to come to the FIRC. FIRC also has enrollment guides that work out of the care clinic if Frisco is a more convenient location. The hospital has a part-time enrollment guide, and certainly if you qualify for Medicaid, Summit County Human Services is a great place to go for resources.
Great. Now, talk a little bit about the Marketplace website. Now, I personally am somebody who doesn't have healthcare right now, so I'm going to have to be doing this whole thing, getting on the Marketplace website, doing the Connect for Colorado, and trying to navigate that whole system. How is the website? Is it pretty usable? Is it user-friendly?
Yeah, it's pretty user-friendly, especially for folks who are used to being on a computer and used to filling out forms online. There are still some glitches in the system, so if you run into any of those, you can give us a call. Perhaps we can just help you over the phone. A lot of folks need to come in once they've kind of hit those roadblocks in the system.
Yeah, and like I was saying, I myself am going to have to be digging through that system. What do I need before I even start applying, or what do I need before I even sit down at the computer to make sure that I'm not spending 3 or 4 hours getting all my stuff together?
What we always tell folks when they're filling it out on their own is think of it like a tax document. Try to use all official information that would be stored in other systems. You definitely want to have your annual income from 2017 just to give you an idea of what your annual income for 2018 might be, because that's what we're going to base the tax credit off of.
Now, looking beyond the Marketplace and some of that, there are also other options that low-income families especially have, including Medicaid. What is new or different with Medicaid, or what is you find tripping people up when they're trying to apply for that program?
So just before we get to Medicaid, one more thing I think we should mention about the Marketplace, that there's been a lot of coverage in the national media about this thing called cost-sharing reductions going away. Those are actually still in place in Colorado, and what those do is, in addition to allowing folks to access their subsidy for their premiums, cost-sharing reductions can also bring down the deductible and the out-of-pocket maximum for a plan. So if you're on the lower end of the economic spectrum, that might be a really good option for you if you don't qualify for Medicaid. But you're right, Phil, Medicaid is also a really good option for a lot of Summit County residents.
Yeah, Medicaid for a single individual making around $16,000, $17,000 annual, you'll be eligible for Medicaid, and a family of four making around $33,000 will be eligible. And it's a really simple, straightforward process to apply. It's actually the same application as exists for tax credits, and we just kind of make the same recommendations. If you get stuck in the system, you're welcome to come to FIRC. The Summit County Department of Human Services is also a great option for applying for Medicaid.
Okay. As far as Medicaid, there are some other programs kind of with that. Now, CHP Plus, is that part of Medicaid, or is that something that's tied to Medicaid?
CHP Plus is a program for children and pregnant women who make more than, they make too much to qualify for Medicaid.
Gotcha. Okay, so they make too much to qualify for Medicaid, but that program itself, CHP Plus, is also potentially facing some changes here as soon as January.
Yeah, unfortunately, our federal government hasn't refunded that program. So in Colorado, if you're covered under CHP Plus, you should start looking for other options in early January, as your coverage will end January 31st unless the federal government acts to refund the program. You can go to our website to find out updates. But please continue to use your coverage, whether you're a child or pregnant woman, and FIRC is here to help you with your next steps.
Yeah, so it's a lot like the marketplace in general. It hasn't disappeared yet. So until that happens, or until they decide to renew it even, it's there. It exists.
That's correct. And there's another really great program that a lot of folks don't know about called the Medicaid Buy-in Program for working adults with disabilities. And you can make a lot more and still be eligible for that program, a lot more than the regular Medicaid limit. And you could have qualifying disabilities such as diabetes or arthritis, epilepsy, severe depression, etc.
Okay, great. So lots and lots of options for locals as they're trying to navigate healthcare. When it comes to the help that they can get at FIRC, like we've talked about, if people get confused or if they get thrown off, what are some other services that you offer folks, whether families or individuals, as they're trying to navigate healthcare?
Right, so I think, for Summit County working families, the struggle is really threefold. It's not just that health insurance is expensive, it's that housing is expensive and childcare is expensive. And unfortunately, our salaries and our income don't always keep pace with those expenses. And so at the FIRC, we really try and offer support to families in all three of those areas, because hopefully if we can help a family find a strategy in one of those three areas, it might be able to provide enough relief to make the other two areas a little bit more sustainable.
Sure, so it's kind of a one-stop shop if you come into FIRC. So you don't just have to talk healthcare. You can also get some advice and some help in other ways.
That's right.
Now, the final question that I had for you was, as people are looking at healthcare and their providers, what is the state of providers for Summit County? Because I know there's also been lots of talk about the fact that there just are not many who are working with folks who live in the high country or in certain regions, like we're region 9 in the mountains, I believe.
That's right. So, I think that it depends on the specialty that you need, but certainly Centura and Kaiser and the Care Clinic have worked very hard to make sure that the providers you need are available in Summit County. And a lot of that is going to depend on your insurer and the network that your insurer allows you to visit. So it's not only important to make sure you have insurance, it's also important to make sure that you take the time to understand your insurance, understand which doctors you can go see, and what services are covered under your plan, and what your deductible is going to be if you do need services.
Yeah, and I'd just like to add, too, that if you do have insurance through the marketplace or your employer, you're likely, almost always likely to get a free annual visit. And a lot of folks up here don't take advantage of that opportunity just because we're healthy or we think we're invincible or whatnot.
Well, and that's the truth too, is that, it's important to simply have insurance. Like you said, don't just pull the trigger on any cheap insurance that you find, but it still is important to make sure you have insurance for yourself and your family, because we live in the mountains. We live in places where people like to play, and I myself know very well how expensive something like a knee injury because of snowboarding can get.
That's right. I mean, I think it's easy to look at the premiums every month and just say it's exorbitant. There's no way that I can afford that. But remember, the alternative is some kind of a medical emergency that could end up costing you and your family $50,000 to $60,000 to $70,000. And so at some point, it is a little bit of a risk just to roll the dice, even though I do recognize, and we all recognize, how difficult it is to make all of this work in everybody's budget. I think the other thing to remember is there's definitely a correlation between communities that have high numbers of people who don't have insurance and the cost of health insurance premiums in those communities. So the more of us that are able to figure out how to get health insurance, there really is a good chance that that will make it easier for all of us to be able to afford health insurance.
So a little bit of a feedback loop there on that sort of stuff. Great. Anything else that we haven't touched on yet that you guys really wanted to make sure we talked about?
Sure. I guess just to give folks a picture of what their insurance might cost based on some common scenarios. If you're in your early 30s and you're making around $30,000 a year, you can often get a silver level plan for around $150 a month, which is highly affordable. You get co-pays for a lot of visits. I just helped a family of 4 whose income was around $75,000 annual enroll into a bronze plan for under $200 a month. So there's options
for the entire family?
For the entire family.
Our entire family.
So there's definitely options out there for everyone. Well, I shouldn't say everyone, but for a lot of folks. And it's always worth it to come in and apply for that tax credit just to see if that can help you lower your costs.
And Phil, I'd just add one more thing about the big picture. There's a lot of entities in Summit County that have been working very, very hard to find long-term solutions. Certainly Commissioner Dan Gibbs, Representative Millie Hamner, the Summit Foundation, Centura Health Systems, our federally qualified health clinic, the Care Clinic, Summit County government. Everyone has been working really hard to find some long-term solutions. I think everyone recognizes at this point that it's a genuine crisis for our community. And for those of you that are really struggling and are above that 400% benchmark, the best thing that you can do right now is to pay attention to what's happening in Denver and the legislature. And if you have an opportunity, contact a legislature or contact a U.S. senator and really voice the struggle that you're facing, because that's the only way that some of these changes that we need in this community are going to happen.
Yeah, absolutely. Use your voice because, again, healthcare is a system that's in place to help us, not to make life more difficult than it needs to be. Great. Well, thank you again to Danielle and Tamara for coming in, for the FIRC for helping out. And of course, you can always visit summitfirc.org to see all the services they provide. And a consultation is free.
That's right.
Great. Thanks for coming in, you guys. I appreciate it.
Thanks for having us, Phil.